Hello and welcome to Providence Children's Facebook Live. My name is Holly Jacobson. I'm the marketing coordinator here at Providence Children's Hospital, and today we are honored to have orthopedic surgeon Dr. Jacob Heydemann with us. So today we're just going to be discussing his services, how they could potentially benefit your child, and then y'all are free to chime in with any questions you have. I'll be looking for questions, so feel free. So, explain to us, what is an orthopedic surgeon?
Technically, orthopedics is the subspecialty area of medicine that deals with the bones and joints of the body, the muscles that power them, and the nerves that supply them. So basically, it would be the limbs and the spine.
So whenever it comes to pediatric orthopedic surgery, so what is the difference? I know that it obviously has to deal with children, but is there any differences in the types of services you offer there?
Pediatrics is a subspecialty area within orthopedics that deals with children. Children are not just small adults. They have a lot of separate issues that have to deal with an awareness about their growth and their future development and monitoring them well into the early adulthood. So there are congenital issues, there are infection issues, there's issues that have to deal with trauma and how it may affect them in their future life. That makes pediatrics a subspecialty area separate from the general orthopedics.
So like you said, trauma. I think that's what that's what first goes through their mind whenever they hear orthopedic surgeon. They probably think if my child falls, breaks their leg, they may need to see an orthopedic surgeon. But whenever it comes to congenital, what would qualify? What are some diagnoses that you see that would fall under that category?
Well, congenital are things that children are born with. So like a club foot or a developmental anomaly in the formation of their legs or their arms, a deficiency in how the limb or the arm or the hand developed. There's anomalies in function. And then there are genetic deformities that have to do with their genetic makeup, such as bone formation issues like osteogenesis imperfecta or brittle bone disease. So there's a lot of areas that are subspecialty area that pediatric orthopedics has to deal with.
So whenever it comes to a leg length discrepancy, or their limbs are uneven, they have a bit of a limp, how do you go about treating that? And how does a parent know if it's severe enough to come see an orthopedic surgeon?
Well, first of all, a limp could be caused by many different things. And one of those things is a leg length difference. If the leg length difference is mild or minor, such as less than a half an inch, and it remains that, then by adulthood it may not be an issue for that child. But if the difference is increasing as the child is growing, that can be a significant problem. If it developed in early childhood and they go through their entire growth process, it may turn into a very large difference that may have to be addressed surgically at some time in the future. A limp, though, could be caused by a trauma, could be caused by infection, it could be caused by a leg length difference, and so that's something that needs to be evaluated as to what the underlying cause is.
So you see children of all ages, teens, younger children, you also see adults. What would you say is the most rewarding aspect of what you're able to do, the help that you're able to provide to their lives?
I think the area of orthopedics that makes it fun is that you're helping people to advance in their life activities. You might have to be able to take someone who had an injury and return them back to their pre-injury state. Or you might have someone who has a birth issue, and you might be able to maximize their potential and their developmental activities in their school and their workplace and their lifestyle. And those are the rewarding things, dealing with families and watching the child grow and watching the families through their life and watching them graduate from schools. I've been involved with all of that through the years.
So if a child sees you at a young age, you're saying that you've been able to kind of watch them grow and see them progress throughout their life. So are most of the surgical cases you see, or non-surgical, will they be seeing you on a frequent basis, for the remainder of their lives, or a lot of them just it's for a few months and then they kind of taper out?
Certainly a child who has a trauma, like a fracture or a cut or something of that nature that is an acute event and it doesn't affect their growth or development, then once that is healed, those children go back into their normal lifestyle and activity. But there's others who have something maybe that they were born with. That's, for example, a hip dislocation or a congenital foot deformity. And those are children that we'll be following all the way through until their late adolescence, until they've achieved skeletal maturation.
So I know that whenever infants and babies are seeing their pediatricians, they're being evaluated for their hips, and I'm not sure all the logistics behind that, but there are a lot of cases where they are referred to you from their pediatrician, right, based on how their hips are forming?
Yes.
So how do you treat, and if an infant is showing some abnormalities in their hip formation, how do you go about, is that purely a surgical procedure? Is there things that you can do, or do they just grow out of it naturally? Or is that just something you monitor over the years?
It could be any one of those. And so many times for a congenital hip insufficiency or laxity, those children may outgrow that over the first 6 weeks of life. Some may need to have some minor intervention with either bracing or follow-up or repeat ultrasounds. And then there are others that, a small percentage, where that is not enough and the hip does not form well. And it may require a surgical procedure, either a reduction with the child asleep or even a surgical procedure where the hip has to be physically placed into the socket, and the socket may have to be, or the cup, or the hip, the cup, may have to be reshaped to contain that. So those are all potentials. But surgery is, again, is a small percentage, and many times things can be managed without that.
So in the rare occasion that a child does need surgery, how do you go about preparing the child and their family for the procedure? Because I'm sure that many parents hearing that their child needs surgery, it's a frightening thought. So how do you go about kind of introducing the idea of what they can expect?
I think in the very young child, you're dealing more with the parents, and you're trying to talk with them, explain to them what the issue is and what their options are. And sometimes surgery is just one of many options that's available to them, and it may not be something that we're going to have to do immediately, but pre-planning, thinking about it, that if things keep going down this direction, then we're going to probably have to look at a surgical procedure, and trying to discuss with them what that would entail. But as the child gets to be late childhood, early adolescent, and they can comprehend what is going on, I think it's best to also include the child and talk to them directly about what they're going to be facing and what their fears are and what their concerns are, so that when they come to the day of surgery, that they are prepared. It's not like somebody's shockingly taking them out of their home and taking them into a foreign environment, because they've gone through this and their questions have been answered. And then at the time of surgery, before surgery, it's the same sort of thing, trying to allay their fears before they go into the operating room with the whole team, not just myself.
So you mentioned earlier that after a child goes through a surgical procedure, you kind of assist them with getting back to their day-to-day activities, whether that be sports or just having the ability to walk comfortably, not be in pain. So how do you help transition a child who maybe is very active in, contact sports like football or anything like that? How do you adjust them getting back, after, I'm sure they took some time off, their bones are healing and things of that nature. So how do you help them transition into getting back to their normal activities?
Well, the rehab is a team event also. It's a team approach. It's not just me, but it's their family, and going through with them, getting over their fears of starting to move their limb again and starting to use their limb again, and advancement of activities slowly and gradually, but also with the assistance of a physical therapist or occupational therapist or both, to help them learning how to advance their function and get them back into general lifestyle or a sports-specific exercise program.
And I know that here at Providence Children's Specialty Clinic, we do have a physical therapy program that can help children adjust after their surgery, and also it can, and correct me if I'm wrong, it can also be beneficial to children who have braces and things of that nature. So what kind of things would you send a child to a physical therapist, not even if they've had a surgical procedure, but other diagnosis? What would they need physical therapy for, or rehabilitation?
Well, if it's the post-trauma case or the post-surgical case, it would be for that, and there are excellent physical therapists here in the pediatric physical therapy department, and an occupational therapist that deal just with children here as well. But then there are the child that may be of special need, the child with cerebral palsy or spina bifida, myelomeningocele, or some other form of congenital issues or genetic issues that have affected their formation and their development, either physically and or mentally, and working with those families and with those children. And the therapists here have received special training in children's therapy management, and I think that also sets them apart from, just like pediatric orthopedists, it sets them apart from the general physical therapy.
So if a parent is suspecting that their child may need to see you rather than just seeing their pediatrician, they're showing signs of something that's a little bit more serious, what would your advice be to a parent who may suspect that there may be an underlying issue?
I always think the first line of involvement should be with their primary care physician. That is the person that they have a relationship with. That's the person who knows them as a family, knows their child. They are often the ones who can identify with the family that something is now different than what it was before. And then it's a matter of either referral to someone like myself, or maybe even a pediatric neurologist, and working as a team with me, or a pediatric physical medicine specialist, which also is available here in the pediatric specialty clinics, and working as a team approach to address and problem solve to achieve what's best for their child, and what tests may need to be done or interventions may be necessary.
Great. So is there anything else you'd like to add for any parents that may be watching?
Well, I think that when something comes up that if you have a question or a concern about, I think it's something that you should address with your primary care. Certainly specialists are available. We're always happy to see children in our office. Insurances, though, intervene with that and may direct you to go back to your primary care first. But I think that don't think that something may get better if it's not getting better. So if you've watched it for a short period of time and it's not getting better, I would not delay.
Well, thank you so much for being here. We really appreciate you sharing information about your services, and I'm sure that a lot of parents are really, really grateful to have this opportunity to hear from you one-on-one. So at the Providence Children's Specialty Clinic, as you heard, we offer many services here that could impact your child's life in a positive way. So I encourage you to contact us at 915-577-7888. Once again, thank you, Dr. Heydemann. We really appreciate your time.
Thank you, Holly.